Hello medicos, welcome to the official Handshake Medical YouTube channel. I Kashikey Dwivedi is here with you. Today I am going to deal with the very important topic, that is the stomach bed. So first of all, where you would find it? So you would find it in the relations of the stomach. So actually in the relation of the stomach, you would find two topics. One is the peritoneal relation and the other one is the visceral relation. So actually one is the peritoneal relation and other one is visceral relation. So in visceral relation we actually study the viscera related to the organ which we are studying. So here we are studying the stomach. So the organs or the structures related to the stomach, it's actually we study in the visceral relations of the stomach. So in visceral relations too, we actually study the viscera or the structure associated with the anterior surface of the stomach. There we study liver, diaphragm, transverse colon and the anterior abdominal wall. And second one is the posterior surface. So from the posterior surface of the stomach, all the organs or the structures, all the viscera related to the posterior surface of the stomach, we actually combinedly, collectively termed a special name, give a special name to it, known as the stomach bed, which is a very important topic and also the topic of our today's discussion. So I will deal with the stomach bed today. So now coming on to the stomach bed. So stomach bed, what is it? It is the relations of the organs or the viscera which are associated with stomach from its posterior surface or the posterior abdominal wall. As the name also suggests, the stomach bed. Bed is actually when we lie on the bed, our dorsal or the posterior surface is associated with the bed. Assume this to be the stomach. So all the organs, all the structures, all the viscera associated lying beside the stomach are combinedly we give it a name, stomach bed. Now I am giving you an example that would clear your concept of the stomach bed. So assume of a patient of a bed sore. You know very well about the patient of a bed sore. He is lying on the bed for a several long duration. So when the patient is lying over the bed, for a longer duration of time, so the various of the unevenness or the hard structures of the bed make a impression or make a mark over the posterior or the dorsal surface of the bed sore patient. So when we look over the dorsal or the posterior surface of the bed sore patient, we would find various of the remark, impressions of the bed. Likewise, when we took over a formalin preserved specimen of stomach in our hand and look over it, so on the anterior surface we would find some of the organs or the structure related to it, and also on the posterior surface we would find the structures or the organs or the relations or the impression or of the various of the organs, viscera over which the stomach is lying. So all the posterior surface viscera relations of the stomach we would include in the stomach bed, or we would study in the stomach bed. Actually, when I would further specify, it is actually the posterior inferior surface relations of the stomach. So what is the stomach bed? It is the posterior inferior surface relations of the stomach. Now coming on to the topic further, now studying about the structures or the viscera associated with the stomach bed that are lying on the posterior surface of the stomach, forming the stomach bed, or we are combinedly giving name to it as a stomach bed. So actually in the stomach bed we would study the 7 or the 8 organ lying beside the stomach that are coming in the posterior inferior surface relations of the stomach, and giving it a combinedly giving it a name, that is the stomach bed. So coming on to the structures or the content of the stomach bed, one thing, so here I am saying that 7 or the 8. So what is this? So actually this is the spleen. So actually here I would give you a note that spleen is actually sometimes included in the stomach bed. Some books have written spleen as a content or the posterior surface relations of the stomach, and some books have not written this. So here lies a catch which I would give you a note of that. Now coming to our topic first of all, so number one content is the left crus of the diaphragm. Actually, stomach is lying on the left side of our body and liver is on the right. So all the organs which are in pair, like suprarenal gland, we would include left suprarenal gland here. Similarly, kidney is also in pair, so we would include the left kidney in the stomach bed. So I would discuss all the structures from the upside to the downside, from the upside to the downside. So first of all, first structure is the left crus of the diaphragm. So this one is the left crus of the diaphragm. This one is the left crus of the diaphragm. Secondly, left suprarenal gland, left suprarenal gland. Third one is the left kidney. This one is the left kidney. Fourth one is the spleen, and spleen is sometimes included in the stomach bed and sometimes not. So I would give you a note here that actually we would include the structures that are separated from the stomach by the cavity of the lesser sac only in the stomach bed, but spleen is actually separated from the stomach by the cavity of the greater sac of the peritoneum. So some books have written that spleen is included in the stomach bed, some books have not written it. So you may write it, but in bracket you will give a term sometimes, because we would include only and only the structures that are separated from the lesser sac in the stomach bed, and spleen is separated from the stomach by the greater sac of the peritoneum. Now next one is the splenic artery. So splenic artery is a branch of the celiac trunk. We would know very well about the celiac trunk. I would also explain you when I deal with the blood supply of the stomach. So actually what would happen from the heart, I am giving you some detail about the celiac trunk because it is very important. So actually what would happen from the heart, major supply to the systemic or the body is by the left ventricle. So from the left ventricle there arises the aorta, and aorta ascends and forms the arch of the aorta, and when it descends in the thorax it forms the thoracic aorta, and when it passes through the diaphragm, through the aortic hiatus or the aortic opening of the diaphragm, it reaches to the abdomen, and now in the abdomen this aorta is actually known as the abdominal aorta, and abdominal aorta is actually the 10 branches, which we would, for the sake of our understanding, for the easy study, we would study in the 4 parts. One is the ventral, second one is the dorsal or the posterior, third one lateral, and fourth one is the terminal. So in ventral part of the abdominal aorta we would study 3 arteries. One is the celiac trunk supplied to the foregut, second one is the superior mesenteric artery supplied to the midgut, and third one is the inferior mesenteric artery supplying to the hindgut. So the celiac artery forms the major blood supply of the stomach, liver, and the gallbladder, duodenum, and spleen. So celiac trunk is very important. I would discuss about the celiac trunk in very much detail when I deal with the blood supply of the stomach. So coming to our topic again, so in next relation there is the pancreas, then next one is the transverse mesocolon, and the next one is the splenic flexure of the colon, splenic flexure of the colon. So this one is the transverse colon, this one is the transverse colon, and here lies the spleen, and here this transverse colon flexes, forms the splenic flexure of the colon, also known as the left colic flexure. also known as the left colic fracture. We are actually studying the content of the stomach bed from the upward to the downward. So next to the transverse mesocolon is the transverse colon, and actually we include the splenic flexure of the colon in the stomach content because this is actually associated or related with the stomach bed. So this one is a part of the splenic flexure of the colon. Actually this is the transverse colon and this one is the spleen. So here lies the splenic flexure of the colon or the left colic flexure. So these are the 7 or the 8 relations. You may memorize it by the help of a mnemonic, that is the Dr. S3 kills patients mercilessly. So the first letter of every word in this mnemonic actually are the name of the contents of the stomach bed. So actually D stands for the diaphragm, that is the left crus of the diaphragm. Second word in the mnemonic is the S3. So S3 means the 3 organs or the 3 structures of the stomach bed have its name starting with the letter S. So number 1 is the suprarenal gland. Actually you would include the left on your own because stomach is lying on the left. So all the structures that are in pair and are associated with stomach, we would give it a prefix left before its name because it is actually the left of the paired organ like the suprarenal gland and the kidney. So the left suprarenal gland and the left kidney are included in the stomach bed because stomach is lying on the left side. So here number 1 is the suprarenal gland. So you on your own give it a prefix left. So left suprarenal gland. Second one is the splenic artery, and the third S stands for the splenic flexure of the colon or the left colic flexure. Now the patient, the first letter of the patient is the P. P stands for the pancreas. So this one is the pancreas. This is the next relation, which is the pancreas. And now the next letter of the mnemonic is the mercilessly, and the first letter of the mercilessly is the M, and M stands for the mesocolon. So actually the next relation, next content of the stomach bed is the transverse mesocolon. Now I hope that everything is clear to you all. One more thing I would like to give you a note, that when I would deal with the visceral relations of the kidney, so in the anterior surface of the kidney or the anterior relations of the kidney, I would show you that the left kidney, actually the left kidney is included here in the stomach bed. So left kidney in the relations, when I talk about the anterior relations, anterior visceral relations of the kidney, I would show you there that there exists the splenic area, pancreatic area and the gastric area that are also the content of the stomach bed. So this much I would like to give you a note. So I hope that everything is clear to you all. Stomach bed is now on your tips. So thanks for watching. Thank you.